35 years, both professionally and personally. He is a gifted physician who is intelligent, soft-spoken, caring, and deeply committed to providing the highest standard of medical care to his patients and to make meaningful contributions to his community. I believe that his deepest passion lies in the service of our underserved patients, particularly those who are deaf, hearing impaired, physically disabled, isolated, or of advanced age. He has devoted a great deal of time and energy to advancing his education and developing programs to better serve these patients. Tom is a graduate of Regis High School in New York City, in Manhattan. Now, my father, who was a former patient of Tom's, thought that was the pinnacle of his resume. My father grew up in New York City, and he knew that the smartest kids went to Regis, which is still is a scholarship school. He told his friends, my doctor went to Regis. There's more. He apparently went on. He's a graduate of State University of New York at Stony Brook and the New York University School of Medicine. He completed his residency in family medicine at Mount Sinai Hospital in Montclair, New Jersey. During medical school, he studied medical sign language at St. Vincent's Hospital in New York, and during his third year of residency, he did a rotation in the student health clinic at Gallaudet University for the Deaf and Hard of Hearing in Washington, D.C. Our fledgling practice was one of the only practices in New Jersey that had a TTY device, so that deaf patients could communicate with our office directly. Early in his career as the assistant director of the Alcohol and Substance Abuse Program, he developed a program to film and caption the patient lectures in the inpatient detox unit, so that deaf patients could benefit from the program. Additionally, Tom has been involved in medical leadership in his community. He served several terms as Mount Sinai Hospital Board of Trustees. He served on the boards of Mount Sinai IPA and the Physician Hospital Organization. He served as the chair of the Ambulatory Care Committee at Mount Sinai Hospital and as medical director of a local nursing home. He has been school physician in his community for over 25 years and cares for the police department, Taylor Township employees, and the rescue squad. Tom has special interest in geriatrics, in which he holds a certificate of added qualification. He developed a program called Primary Care at Home for Vanguard, and this team cares for over 500 patients in the community who reside in private homes, senior apartments, assisted living, and long-term care facilities. One of Tom's long-standing interests has been in healthcare information technology and clinical informatics. He recently completed his master's in biomedical informatics at the Oregon Health Science University. His capstone thesis was an analysis of the transitional care information gaps experienced by primary care physicians in New Jersey. He is now board certified in medical informatics by the American Board of Preventive Medicine. He serves as both Chief Medical Officer and Chief Medical Informatics Officer for Vanguard and is responsible for clinical and quality performance and population health strategy. Tom is also the founder and president of Care at Home New Jersey, which is a not-for-profit organization that he created to support the non-medical needs of homebound adults and their caregivers. The Care at Home staff includes a program director, 2 social workers. It provides a range of resources that include video chat sessions to almost 60 socially isolated elders each week, monthly support groups for caregivers, social workers visit the homebound, and there's a website database of services that come to the home. In 2014, his efforts to extend quality medical care to homebound seniors in his community were recognized by our Academy. He and his team were awarded the NJAFP Patient-Centered Innovation Award. Last May, Tom accepted the Comprehensive Primary Care Champion Award, which was bestowed by the Center for Medicare and Medicaid, CMS, at a national conference held in Baltimore. Under his leadership, Vanguard's Medical Corona Office excelled among 63 New Jersey practices that participated in CMS's Comprehensive Primary Care Initiative. 3 practices from across all regions of the country were invited to meet with Mr. Andy Slavitt, who at the time was acting director for CMS, to discuss how their successes were achieved and to share ideas to improve healthcare in the United States. Tom was honored to represent Vanguard at this meeting. Now we're involved in CPC Plus, and Tom is serving point on this huge undertaking, guiding Vanguard through the process and serving as a local expert resource to our medical community. Tom McCarrick is an outstanding family physician who has made significant contributions to the practice of family medicine. He has spent more than 30 years nurturing and mentoring family practice residents from the Mountainside Hospital program in Montclair. He has been recognized for his initiative to improve medical care for the elderly, homebound, and special needs patients. Tom is respected by his peers, loved by his patients, and is truly deserving of the 2017 New Jersey Family Physician of the Year Award. Tom.